Hello, my name is Selena Samaria.
My name is Rhiannon Conlon.
Our presentation is about rheumatoid arthritis. What is the cause of rheumatoid arthritis? The result comes from someone's immune response. The body's immune system starts to attack to its own healthy cells, and slowly the signs and symptoms will appear. The main reason for RA is still unknown, but some factors play a major role in developing the disease. Clinical signs and symptoms: joint pain, tenderness, swelling or stiffness that lasts for 6 weeks or longer. Joint stiffness is usually worse in the mornings and after inactivity. Some patients have fatigue and some low-grade fever. Symptoms usually come and go, and it depends on the inflammation each patient has. Usually, signs and symptoms appear in both sides of the body, for example, both hands or both knees. Oral effects of RA. TMJ issues may occur up to 75% of patients. There also may be symptoms of crepitus, loss of motion, and limited ability to open the mouth and keep open for a long period of time. Oral infections can occur, such as gingivitis, periodontitis, and Sjorren's syndromes. Delayed oral healing may be a result due to patients taking immunosuppressives. There may be higher rates of bacterial plaque due to limited dexterity and removal. Decreased salivary flow, radiographic bone changes may be visible.
So here's an example of a patient with rheumatoid arthritis, and they also have a severe case of periodontitis. And you can see here on the radiographs, their hands and their mouth as well. So some common treatments: exercise by strengthening the muscles, less stress and tension will be on the joints. Heat by improving pain tolerance in the patient and relaxes the muscles. Surgery, and in some cases, joint replacement is needed. Medication: pain relief drugs such as ibuprofen, tramadol, narcotic containing pain relievers, and corticosteroids. So, dental management considerations in patients with rheumatoid disorders. Patient evaluation and risk assessment. Evaluate and determine whether rheumatoid or joint disorder exists. Obtain medical consultation if disease is poorly controlled or undiagnosed, or if the diagnosis is uncertain. And potential issues and factors of concern. If the patient is taking aspirin or other NSAIDs, be aware of dosing and may need to be modified in consultation with the physician. Allergic reactions or lichenoid reactions are possible for medications. Excessive bleeding may occur if major surgery is performed on patients who take aspirin or other NSAIDs. Patients who have a prosthetic joint replacement should be managed according to the ADA guidelines. Obtain a blood cell count with differential if surgery is planned for patients taking gold salts, pensalamine, antimalarials, or immunosuppressives. And follow up and monitor dental and periodontal health. Routine follow-up evaluation is appropriate. So keep appointments as short as possible. Allow the patient to adjust themselves in the chair for comfort. Supine position may be uncomfortable for the patient, and have the patient sit in a more upright position. A pillow or a rolled towel can be used for support. Perform curettage in small conservative segments. Recommend cleaning aids that are possible to use with limited dexterity, such as power toothbrushes, interdental aids, irrigation devices such as a water flosser. So here's our questions. What are some common treatments for individuals living with rheumatoid arthritis? What is the best position in the dental chair for the patient with RA? So here are the answers: exercise, heating pad, surgery, and pain relief medications, and an upright position or whatever is most comfortable for the patient. So here's our works cited. And thank you so much for listening to our presentation on rheumatoid arthritis.